NG tube insertion and removal. I'm going to start by showing up in my uniform. I will check the order form and hospital policy. Identify the patient, Mr. Jaguar Jones, date of birth 8/25/1963, verified by Jaguar Jones, date of birth 8/25/1963. I can also see that Mr. Jones is allergic to penicillin. I can ask him what kind of reaction he has and if he has any other allergies not noted. At this point, I would gather my materials and check any expiration dates and don my goggles. Perform hand hygiene. Raise patient's bed to a comfortable working height. Lower the side rail. Going to auscultate his bowel sounds. While I'm auscultating, it's important to remove the patient's linens and raise the gown. Next, I'll take the patient's vital signs, including placing an oximeter on the patient's finger to remain there through the entirety of the procedure. If his oxygen level decreases, I will stop inserting the tubing. Next, I will establish a cueing signal with Mr. Jones for if he needs me to stop the procedure at any point. I will now place the patient in high Fowler's position. Next, I'll perform hand hygiene again. I will open the NG tube kit away from me. I will dollop lubricant onto the packaging. Next, I would cut out 4 pieces of tape, which I have already done. These 4 pieces of tape are going to be used to loosely secure the tubing on the cheek temporarily, secure the tubing to the nose using a floating tape mechanism, labeling on the bridge of the nose with the date and the time, and marking the measurement on the NG tube. Next, I'm going to perform hand hygiene again and put on clean gloves. I'll now place a towel over the patient's chest and abdominal area, place a basin on their stomach, and give them a cup with a straw with liquids for small sips during insertion. Next, I'm going to measure the NG tube. I will be placing the NG tube in the patient's left nair, so I will measure from the left nair to the ear, the left ear, and from the left ear to the xyloid process. This is where I will use my first piece of tape, marking this measurement. Next, I'm going to lubricate the end of the tube. And now I'm ready for insertion. I will start by inserting towards the back and the ear until I get to the nasopharynx. When I get to the nasopharynx, I will ask the patient to relax and flex their head forward and begin taking small sips of their drink while mouth breathing. Every time they swallow, I will advance the tubing, twisting the tubing 180 degrees. I would stop insertion if the patient began coughing, choking, or their oxygen level decreased. Now that I've made it to where the measurement is marked, I will take a piece of tape and loosely secure the tubing to the patient's cheek. Now I'm going to check for placement of the tubing. I will first do this by using a tongue blade and my pen line and asking the patient to open their mouth, checking the placement in the back of their throat. You can also check the placement using radiography, gastric context aspiration, and pH paper. At this point, the tube is in the correct spot, so I will secure it with the floating tape. The middle of this is cut. And before I tape this, I'm going to prep the bridge of the nose with an alcohol prep pad. Going to first stick to the nose and then wrap around the tubing. This floating tape mechanism gives the tubing room to move. Now that I've secured the tubing onto the nose, I can remove the temporary piece of tape stuck to the cheek. I will then take my last piece of tape and mark today's date and time. This will go directly on the bridge of the nose. At this point, if suctioning is ordered, I will connect the tubing to suctioning. Whether suctioning is ordered or not, the tubing needs to be above the patient's stomach. I'm going to symbolize this by placing it here. Typically, it would go on over the head of the bed. At this point, I will remove any supplies and assess the patient for comfort. I can lower the bed to the lowest setting, but the patient needs to stay elevated to no lower than 30 degrees. I will bring any personal items or things that the patient may need in reach, like their call bell or their phone, within reach of them, and I will have 3 out of 4 side rails raised. At this point, this concludes the insertion, so I will remove my clean gloves and continue with documentation. In documentation, I will put the type of tube placed, the time, the location, or the left nair. I will put how it was secured, how the process was verified, how the patient tolerated, and any secretions, their amount, color, and any other characteristics. Next, I will show how to remove the NG tube. I would again come in dressed in uniform. I will check the order form and compare it to hospital policy. Identify the patient, Mr. Jaguar Jones, 8/25/1963, 8/25/1963, and he is allergic to penicillin. Again, asking if there are any allergies not noted. I would then explain to the patient, Mr. Jones, today I'm going to be removing your NG tube. At this point, I will perform hand hygiene and put on clean gloves. Before I raise the patient into high Fowlers, I'm going to auscultate bowel sounds, again making sure that the linens are pushed down and the gown is raised. At this point, if any suctioning was ordered, it would be disconnected. And I will place a towel again over the chest and abdominal area of the patient. I'll begin by removing any tape. I'll then kink the tubing, ask the patient to hold their breath, and with one swoop remove the tube. Once the tubing is removed, I will wrap it in the towel and dispose. Once removed, I will assess the patient for comfort. I will collect any drainage and perform oral hygiene or oral care. After this, I will remove clean gloves, lower the patient's bed, raise side rails, and do documentation, and that is NG tube insertion and removal.